see the data, we're still on the upward trend and haven't yet reached the peak of this. So we're very much in the thick of it. We know that what we're doing works, and that's why we're continuing to do it. And as long as we are aggressive and disciplined and smart about the situation we're currently in, we will be able to get through this faster. We'll be able to get our economy back on track faster. And every time we interact with folks that aren't part of our home, that aren't part of an essential business we need to be in, then we are extending the time it's going to take for this to peak. We are elevating how much it's going to peak, and we're extending the time it's going to take to get back to normal. On the latest data, we are announcing today 135 additional cases, which would bring us for Houston and Harris County a total of 2,341 cases. I'm very sad to report we also have 7 deaths in unincorporated and areas outside the city of Houston in Harris County. So 7 individuals died. Most of them have past medical histories. They're all above the age of 60, and the death toll is now at 31 for Harris County, including the city. Remember, these cases are what we can identify with the limited testing that we do have. And so we know that for every case, there's probably many more. We continue to see exponential increases day to day, but we're also seeing results of what we're doing. The bottom line is we need to stay ahead of this thing. When you look at the 3 larger cities before Houston, the 2 larger counties before Harris County, they are all facing a much more difficult level of this crisis than we are. And so we have got to recognize that we're very much at risk, and that's why all the measures we take right now to stay ahead of this and be proactive are so crucial. And so we need to keep ensuring that we're keeping that physical separation. And for that, I'm working to make sure folks aren't getting together and going out in groups this coming weekend for Easter weekend. So I am issuing an order to close county parks starting tomorrow, Thursday at 8 p.m. until Monday, the 13th at 8 in the morning in light of this special weekend. It was not an easy decision for me. I love county parks. I love all our parks. That is the respite. That is my solace, is for me personally to be able to go for a run at our parks. And so it's going to be hard for me, but it's something we have to do. I know it's been crucial to folks' mental health, to folks being able to have that fresh air, and we've seen great compliance so far. Of course, there's always some here or there, but for the most part, folks have been so respectful, so responsible about going out to the parks just by themselves or with someone they live with, and just for a run, or if it's fishing, and not congregating in any sort of group. But this particular weekend, we need to ensure folks are not doing what they always do on Easter weekend, which is spend time in groups at the park, and that's why I'm ordering that those county parks be closed. So the sacrifices we're making, like this one, are not in vain. Each sacrifice is a force multiplier, as we've seen in just a few days, over 4,500 lives saved, and if we continue to do this, we'll curb the spread faster, we'll go back to normal faster, and the flip side is having this take longer. I did speak with Governor Abbott earlier today. Our teams have been in constant communication, and we discussed, and I share his concern about Harris County becoming the epicenter of this crisis in Texas, and that's the concern that I know he's communicated, the federal government has as well, and why we're working so hard to flatten the curve, to build additional capacity, to be proactive, and to be smart. And part of that strategy is also the facility that we're building at NRG right now in the parking lot, but certainly that we're working to build at NRG at our county facility. Yesterday, we approved at Commissioner's Court unanimously up to $60 million for a medical shelter that will serve as a last resort to house patients if our hospitals were to find themselves overrun. So that's a big step we're taking. We should have the capacity for 250 beds, including the necessary staff, by this Friday, and we have the capacity to operate that for 2 months, were it to become necessary, or to operate a larger facility as well. We could go for even more beds, but we're starting at 250. And so all of this, from NRG to the parks closure to the steps we're taking so that we are not and we do not become the epicenter of the crisis in Texas. And I appreciate the support of our state government, our federal partners, and the partnership of all the leaders in this community, including every individual who is helping us get ahead of this and try and avoid the fate that other large communities around the country have already encountered. I'll repeat the remarks in Spanish, and then Dr. Shaw is here, the director of our public health department, and then so he will make some remarks, and then I will we'll both answer questions. En español ahora. Sé que muchas de ustedes, al igual que yo, vimos un estudio de la Universidad de Rice ayer o antier que dijo que gracias a nuestra orden de quédese en casa, trabaje seguro, hemos salvado más de 4.500 vidas, 4.533 personas ellos estiman, quienes habrían perdido la vida si no fuera por los esfuerzos de cada uno de nosotros de quedarnos en casa, de evitar contactos con cualquier persona que viva fuera de nuestro hogar, a menos de que seamos trabajadores esenciales. Entonces, el trabajo que estamos haciendo todos está funcionando, es doloroso, son sacrificios, pero están funcionando, y cada uno de ustedes que está en casa está salvando vidas. Debemos recordar, claro, que todavía estamos en la parte de crecimiento de esta curva. Todavía van subiendo los casos, van subiendo las muertes. No hemos llegado al contagio máximo aún. Lo bueno es que estamos pudiendo detener un poco esa tasa de crecimiento y estamos en camino, la posibilidad de poder evitar lo que otras comunidades grandes han tenido que enfrentar en una situación más trágica. Si seguimos haciendo lo que estamos haciendo, vamos a salir de esto más pronto, para que la economía recupere más pronto y para evitar aún más muertes. El día de hoy estamos anunciando 135 casos adicionales en áreas del condado fuera de la ciudad de Houston. Entonces, en total, la ciudad de Houston, el condado Harris, tenemos ahora 2.341 casos y 31 muertes. 7 personas murieron por el coronavirus en las áreas del condado Harris fuera de la ciudad. Todos ellos tenían antecedentes médicos, mayores de 60 años, pero igual son 7 muertes trágicas dado a este virus. Seguimos viendo ese incremento y por eso tenemos que seguir siendo proactivos. 1, porque las medidas están funcionando, y 2, porque todavía estamos en medio de este reto, en medio del reto. Por eso he tomado la decisión de este fin de semana.
So much transpiring at this hour. We want to switch back to the White House press briefing. We are hearing from Dr. Birx, one of the head members of the COVID-19 task force. Let's listen back in.
The rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people, and I think models are models. I've always worked on validating. I've spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength.
Todos los sacrificios no son en vano. Esos sacrificios en este momento están multiplicando los resultados, las vidas que salvamos y la rapidez con la cual superamos este reto. Hoy día hablé con el gobernador Abbott, nuestros equipos han estado en contacto muy seguido durante esta crisis y le agradecí por el apoyo que hemos recibido, pero también comparto su preocupación, la preocupación que él me dice el gobierno federal tiene de que el condado Harris pueda ser el próximo centro de crisis del coronavirus y especialmente el centro de esta crisis en el estado de Texas. Si vemos las 3 ciudades más grandes que Houston, los 2 condados más grandes del condado Harris, todos se ven en este momento en una situación mucho más difícil de la nuestra, entonces es por eso que tenemos que observar con mucho cuidado hacia dónde vamos. Son otras comunidades de este tamaño que se han visto con hospitales ya llenos, con muchas más muertes, muchos más casos. Entonces, por eso estamos tomando estas medidas proactivas de cerrar los parques este fin de semana y también las medidas que estamos tomando en el estadio de NRG, donde ya estamos estableciendo un centro médico. Este viernes tendremos la capacidad de 250 camas por si fueran necesarias. Ayer mismo aprobamos con los comisionados un voto unánime. 60 millones de dólares para este centro médico en NRG, donde podremos cuidar pacientes de coronavirus si es que los hospitales se vieran sin camas. Entonces, estamos tomando esto muy proactivamente. Estoy muy agradecida por el apoyo del gobernador, del gobierno federal, de todos nuestros trabajadores, otros líderes comunitarios, pero más que nada por todo residente, toda persona que vive en este condado, que nos está ayudando a hacer los sacrificios necesarios para estar adelante de este virus y no terminar donde todas estas otras comunidades grandes a través del país se están viendo. Entonces, con eso, darle a todos las gracias. Está aquí el director de nuestro Departamento de Salud Pública, el Dr. Shah, el cual va a dar algunos comentarios y después responderemos preguntas. Thank you so much, Dr. Shah, Director of our Public Health Department.
Thank you, Judge. Again, Dr. Umair Shah, the Executive Director of Harris County Public Health and the Health Authority for Harris County. And I just want to, first of all, thank you, Judge, for your continued leadership and your support and all of our county leadership. We have had really just a really incredible amount of support from the county for public health activities, and I really want to acknowledge the importance of those activities. And I also want to really underscore what the judge mentioned. We know the long weekend is coming, and we know this is really a time with Easter, Passover, Easter, and all sorts of events and activities that usually on a yearly basis happen when our community comes together. And we definitely recognize the spiritual and the emotional importance of coming together, but we want to make sure that everybody recognizes that we are still in the midst of this pandemic. And while a lot of efforts have been made, and a lot of those policy efforts to really flatten the curve and be ahead of the curve, we want to make sure that we don't have a long holiday weekend when people come together, usually, that we fail to keep each other physically apart. So emotionally and spiritually together, but physically apart. I think that's an incredibly important message right now. We are constantly in touch with our colleagues across the country, other parts of the country that are unfortunately going through an incredibly difficult time, and not just the communities in the healthcare sector. They have shared many vivid stories with physicians like me, with healthcare providers like me, with public health departments like ours. And really the message that they have is do everything you can up front, early, and sustain it. We know it's difficult, but sustain it, because we want to make sure that what's happened within our community, that you can stay ahead of that. And that's why all of the different activities and all of the different initiatives and all the different policies are very much about flattening the curve, staying ahead of it, and doing everything we can to slow the virus down. We've said on a number of occasions that you can't stop a virus, especially a novel virus, a new virus that's part of this pandemic, but we know that we can slow it down. And our real goal is to slow this down and do whatever we can to protect our community. The judge mentioned with Rice University, the Kinder Institute study, that we have saved lives. The challenge that we're going to have is that this is going to be with us for time, for some time here. And that means that while the curve has not gone like this completely in our healthcare system, it has been increasing, and we certainly, it's too early for us to let off the gas or the pedal and say we're okay. We need to sustain all the different activities to really make sure that we're protecting our community. The judge also mentioned that we've had increase in cases, that also is reflection of increased testing. We're glad to have increased testing in our community. We have tested over 7,000 people between our two sites in Katy and Baytown, which has been fantastic. We recognize that's still a drop in the bucket for individuals who are needing testing throughout the community with the two.
So much developing, and we've been listening to updates from both the national and local level, bouncing back and forth between President Trump and Harris County. Closer to home, you should know we are still very much on the upside of the curve, says Judge Hidalgo. There are now 2,341 cases in Harris County, 7 new deaths. And speaking to closures of Harris County parks, the judge said it was not an easy decision this weekend. However, they need to ensure people are not spending time in groups at the park. And also, 250 beds at a county overflow facility will be able to sustain care for 2 months. It is almost ready to go. President Trump had a lot to say as well, but most importantly, the CDC will release new guidance for workers. Also, the distribution of millions of masks to hotspots, and 750,000 gowns arrived in Dallas today. So much more to come.
So we know that individuals who are positive, what their case status is. The bad news is that we have more cases, and that also then brings additional concern in our community. And that's why, as the judge mentioned, we have NRG. That's really the operation that we are standing up. It's going to take several days, but really it's designed not to be opened up, really hopefully, and we never get there until our hospital or healthcare system really gets that surge of individuals. So we're doing everything we can in advance of that. But we also recognize that everything we're doing in government, policymaking, healthcare, our public health departments, all of our partners who are working together, we can't do it unless we do it with you, our community. We have to work together. Again, remember to be emotionally and spiritually together while we respect and remain physically apart. Very difficult for us, but that's the prime message. We have to do everything we can, including our concerns today, and our hearts go out with the families that we reported 7 additional deaths at the county today. We know this is a deadly disease potentially. We're going to do everything we can to really protect each other, protect ourselves, and ultimately protect our community. So I want to thank all of you for everything you're doing to work with us. Realize that we're still in the midst of a pandemic. Realize that it's going to be a long weekend, and we want everybody to be spiritually together. But again, please be physically apart. Thank you.
Thank you so much, Dr. Shaw. We'll take questions from the press now.
Okay, the principal questions coming in are about the park closure. And have you been in discussion with the mayor about, obviously the city has not at this point indicated there's going to be a park closure this weekend. Is this something that's been a discussion point between you and the mayor? How do you think this might affect your plan?
Yes, so I wanted to say county parks because I did see the mayor's message yesterday about the city parks, and we still hadn't discussed it with our commissioners. I think, you know, the mayor's indicated that that they can enforce the social distancing at the parks, at the city parks, and if necessary, they'll take relevant steps. So I'll take him at his word on that. For our part, we just don't want to leave it to chance. We want to make sure we're mitigating any risk. And as with everything, I don't want us to run the risk. And so, but that's why I just said county parks, because I recognize he'd already made that announcement.
Will there be patrols to make sure that people aren't, obviously gates, I presume, would be closed to the parks where they would be unable to drive in, but is there going to be patrols that will look for people who just decide, well, we're just going to walk into the park?
Yeah, you know, as with the order and from the very first one on bars and restaurants, of course, law enforcement is out there watching. Ideally, their role is one to inform, to educate. I expect that folks will comply with this. I really do. And you know, they're out there trying to keep us all safe. They have a much higher incident, our law enforcement folks, of this disease than everybody else because they're in close touch with everyone. And so you're actually helping our law enforcement professionals on the front line by not, you know, trying to skip over a barrier or go past a closed sign. But, you know, we'll see. I don't think, I really hope and trust that the community will continue to do our part, every single one of us. I sure am going to have to skip my run this weekend, and we're all going to, you know, it's hard. It's going to be a hard Easter, but we still can spend it with our loved ones and can spend it together in other ways.
Is there any consideration that the closure might extend beyond this weekend?
Right now, we don't expect the closure of parks to extend beyond the weekend, and that decision was made very carefully when we first discussed the order with all our mayors, and the sense was, you know, we really feel that people need these parks as an outlet, and for the most part, people really have done that. We still have, particularly exercise groups continue to be an issue, and, you know, if you're exercising outside, it doesn't make you any safer than if you're exercising in the gym. There's nothing magical about the number 10 is smaller than 10 people. We should not be in close contact with people that we don't live with, because then you're spreading the virus, and that's exactly what we're trying to curb right now. So, but for the most part, you know, it's been good. We just see that this weekend, opening them up would just be inviting crowds and inviting something that would very much undo the progress we've made, and this is just not the time, when we're still in the upward slope, when we're still in the thick of it, to take 2 steps backwards and have you know, a spike just because everybody decided to go to the park at the same time.
I don't know if maybe Dr. Shaw and you both want to respond to Governor Abbott's comments today about how he sees Houston, Harris County as a hotspot in waiting, and that he's contacted the Vice President about, I guess, some resources. Are you in any discussion with the governor or federal officials that connect to Governor Abbott's comments?
Yes, I've been in touch with the governor. I spoke with him just a couple hours ago, perhaps just an hour ago, about this. Our teams are constantly in communication, and certainly our federal partners. I've been in contact with Senators Cruz and Cornyn as well, and members of our congressional delegation, and, you know, we really appreciate their support, their leadership. Right now, yes, if you look at just the population centers that have seen major outbreaks, that are running out of beds, that are running out of you know, facilities and medical providers, and where we're seeing enormous numbers of deaths, those happen to be the communities that are just larger than us. We have to remember Harris County is the 3rd largest in the country. We're the size of Colorado in population, and so we very much are at risk, and that's why we took the steps early on. Ideally, and certainly we took them earlier than other communities took them. Our residents have been so diligent and so responsible, and we want to continue to do that this weekend through Easter. We ask that that folks help us with that, and we're also planning for a worst case scenario, which is what the NRG facility is about. Dr. Shaw, did you have something to add?
Sure. Just to add to what the judge said is that we, on the public health side, are constantly also in touch with what's happening in Washington and Austin, and really our partners across the country. So we are concerned. We remain hopeful, but we are concerned that we, as the judge has mentioned multiple times, that we are a large community. We have an incredible amount of need in our community. We have incredible challenges in our community. We're geographically very spread out, and there are really concerns that we have about our community and protecting that very community. That's our job. That's what we take very seriously. My whole career has been about taking care of people and preventing disease or infirmity or death, all of those kinds of challenges. And I know the judge, our county leadership, all of us take this very seriously. That's why we're saying to our community, look, while so far it looks okay, and if you walk outside, it may be a beautiful day, and it looks like the sun is shining, and it's a blue sky. That does not mean that we are out of the woods. We still have a long road ahead of us. So let's do everything we can, again, to help these policy decisions. It's going to take continued time, and that, unfortunately, is hard for all of us, so that we can really do what we can to get out of this situation without as much of the challenges other communities have.
Well, you want to stay at the mic just for a second? The question is about looking at the demographic breakdowns of those who are ill and those who have passed. I understand that there is a compilation of that information. Is that something that you're starting to get to a point where it becomes public?
Sure. As you know, our partners at the Houston Health Department had released some information about their deaths in terms of race and ethnicity data. We're actually looking at our information. We're making sure that we have all the correct information and there's data integrity of that information. And as soon as we have been able to do that, which we anticipate will be at some point through the night into tomorrow, then our plan is to release that information tomorrow.
And let me just add on
Sure.
that point. So data is incredibly important just more generally, and so that's why we are assessing, how can we break it down in ways that informs us a little bit more, and we just want to make sure that everything is fully accurate before we release it. But that's where I also want to highlight the importance of testing. As we move forward in time, we're still on the upward trend. At some point, this is going to peak. We are working so hard to ensure that the peak is below our hospital capacity. We're increasing that line, raising that line of capacity by building this medical shelter at NRG. But eventually, we will start tapering down, and at that point, particularly, data will be more important than ever. And so that's why right now we are still in a race against time to get our hands on a lot more tests. Right now, anybody who feels sick should assume they have coronavirus, should stay home. Anybody who needs to be in the hospital, obviously if they haven't been diagnosed, they're still going to call, 911, they're still going to go to the hospital. But for our purposes of being able to plan, and more importantly, to have a more targeted response to this, as we ideally hope one day we begin coming off of it, we're going to have to need a lot more widespread testing. And so I just want to make a note on that point that we're continuing to work to explore all avenues to see how we can get our hands on more tests.
Today, the New York Times published a study that looked at Cook County jail inmates as what they determined to be the single highest source of new corona cases in the United States. Over 100 staff in the jail, they say, have tested positive. Obviously you're getting, there's been a lot of pushback against release of inmates from some in the law enforcement community in Harris County. Does this new information add to the urgency that you've been talking about as far as trying to relieve some of the pressure that could be building in the jail?
Yeah, when people say, they're concerned we'll act too much, we'll overreact, that doesn't keep me up at night. What keeps me up is underreacting, is not preparing, not getting ahead of this. Everything points to we would be the next community at risk for a very, very terrible and tragic crisis. And one obvious source of that crisis is a jail with almost 8,000 inmates. And so, as I've said, and the reason we took action is that when you have so many people in close contact and they begin to get sick, those folks are going to need the same hospital bed. They will need a hospital bed, and guess whose hospital bed they're going to take is going to be the hospital bed you may need, the hospital bed I may need. And so we have to prevent there from being any congregation of 8,000 people. Is just untenable for what's happening right now. And so that's why I took the step to first get in touch with the judges, share with them that this was an issue, then wait, see whether action was taken quickly and aggressively. Instead of that, it came time for me to act because the clock was ticking. And since then, we've already seen, last time I checked the numbers, there were at least 30 inmates with symptoms that were expected to come back positive, in addition to the ones that had already tested. The staff members already were in the double digits and well into the double digits. So every day we wait on this action is challenging. I do take issue with folks who are trying to raise alarm about what's going on in terms of the situation in our county right now. Of course, every crime we take very seriously. These folks that would be released would be folks accused of non-violent crimes. They would be released only if they went through a screening for the virus, of course, for homelessness, to ensure we're not releasing them into homelessness, and also just to ensure that we're not accidentally releasing somebody we should not. But I have heard comments that crime is up. I can tell you I've been in touch with folks, and folks tell me, you know, it's down, save for a slight uptick in burglary of a building and domestic violence, neither of which would be released because they wouldn't fall into the categories. And so, you know, right now is the time to act based on data and based on the best information we have. And the best information is that these jails are epicenters for the virus, that if we don't act aggressively, they will pose a threat not just to the inmates and the thousands of law enforcement and medical workers at the jail, but also to the community at large. And so my plea continues to be, you know, folks either need to take action or they need to let me take action. And I haven't, you know, we're exploring all kinds of options so that we avoid a legal battle. We don't have time for that. We just don't. And I've been pleading with the judges and everyone to get those folks out. We've identified at least 135 people, but certainly up to, you know, the 1,000 folks, and probably once we looked at the backgrounds, it looks like it would be closer to around 600 or upwards around there that could be released that don't have these violent backgrounds per the risk assessments that are always used. And so what are we waiting for? You know, everybody in this community is making sacrifices, individual sacrifices, whether it be economically, whether it be their mental health, their comfort, just their daily routines. And so we can't try and put false alarm or some sort of additional interest ahead of public health and safety. And what the experts are telling us is we have got to reduce the population in that jail, and we would do it in a thoughtful way. And so anybody who's trying to stir up trouble about saying we would release people that we wouldn't be releasing, that is false. I've heard some folks say, you know, it would be proposed that we release folks arrested of domestic violence. That's not true. Is this the kind of thing we just don't need coming out of anyone?
Is there a particular number that you're shooting for to make a meaningful impact? Obviously, if you release 50 inmates, that's not going to have a meaningful impact on the issue. So is there, you mentioned 600, does it really need to be towards 1,000 for it to have an impact in what you're trying to do to create the space needed?
Every person that we release will make a difference, undoubtedly. And already the population has gone down because of the efforts by our law enforcement not to send people to the jail who are low level, who really don't need to be there, particularly right now. And so in that case, that's already been helpful, and I commend folks who've been working with us on that. We are looking to move the inmates that we can move to a couple other facilities. That will be a few dozen, and then, you know, it all adds up. Ideally, what the experts told us at some point is if we could reduce the population by half, you know, to around 4,000 or 5,000, we would be in a place where we can do adequate social distancing, adequate quarantine. Right now, if you add up the numbers, it would be tough to get there with the measures we're taking. But every person that's out there is another person that you're preventing from not getting the virus, not ending up in the hospital. And so we want to reduce as much as possible, as much as responsibly possible. And so there we're balancing those interests, but we're balancing it very carefully based on expert advice, based on the information. And as I've said before, it brings me no political glory or benefits to discuss this, not by a mile. And so the only reason, the only interest in trying to decrease the population is to obviously do so responsibly, but to do so to avoid the kind of catastrophe that Chicago is seeing right now in their Cook County Jail. All right. Thank you so much.